All right, Perla, thanks so much for doing this. My first question that I have for you is, just tell the audience a little bit about yourself and how you started in the community.
Yes, well, first of all, thank you so much for having me on your podcast, Laszlo. It's such an honor to be a part of this. So I appreciate that. So how I got started in the field of mental health, actually, I've had always a lifelong passion for understanding human behavior, and psychology just sort of seemed like a good fit for fulfilling that curiosity. And so when I was younger, around 11 years old, you know, my 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 family went through a major transition. My parents divorced, and I really had a hard time understanding sort of their behaviors and what was going on with the family and sort of like what sort of caused that. And so that kind of sparked my curiosity. So when I went to college, I had decided to major in psychology and majored in psychology at USC. And that was really great. And originally, my plans were to actually enter the field of research. So after I graduated with my bachelor's, I was a research assistant at UCLA working in the neuropsych department for 3 years and had intended to actually go into graduate school to earn a doctorate degree and continue researching human behavior and psychological, you know, topics or, psychological disorders. However, after 3 years of that, I had applied to various grad programs and sort of realized like, is research and sort of being in the field of academia, is that really my true passion? And I didn't get accepted to any PhD programs, and I had to sort of pivot a little bit. And I wondered if maybe being a clinician or a therapist was a better fit. And sure enough, I started to apply to master's programs and got accepted into Pepperdine University and found that being a clinician was a better fit because I could sort of be more direct in how I utilized my understanding and helping people. So I went to grad school at Pepperdine University, got my degree in 2010, and sort of started my career as a therapist, obviously first as a trainee. And then at the time, I was an intern working in community mental health until 2013. And then I went ahead and, passed my board exams, became licensed in 2014, and started working in a group practice, in a private group practice called the CBT Treatment Center in Manhattan Beach. Learned a lot about cognitive behavioral therapy and various anxiety disorders, various depression disorders, mood disorders, and working with, children, teens, families, and adults. And then, worked there for some time. And then in 2019, opened my own practice. And that's what I've been doing since then.
Oh, great. So what do you do in your current role, like in your private practice? What sorts of things do you sort of do?
Yeah. So what I essentially do is I do work with a lot of um, anxiety disorders, including generalized anxiety. However, I mostly see OCD clients. Occasionally, I will work with clients who have body-focused repetitive behaviors. Those are diagnoses that include like excoriation disorder or trichotillomania, or colloquially known more as like hair pulling and skin picking. I also work with depression. I also tend to see a lot of the neurodiverse community or the neurodivergent community. So, working with children, teens, and adults who have ADHD or have anxiety disorders because they are high functioning on the spectrum. And so, I do a lot of my work in terms of like with children and teens, with families who have, children that are neurodivergent, helping them sort of navigate what that means for their child, what their behaviors look like, interventions, and environmental changes that need to be made to accommodate for them.
Mm-hmm. What has what has been like your what are some of the modalities that you use, like when working with these type of patients? Because you work with specific populations, so I'm wondering how what modalities you use.
Yeah, so a lot of the modalities that I use are cognitive behavioral based, especially for things like anxiety disorders like phobias and OCD. What we're finding is exposure and response prevention therapy is sort of the gold standard for treating those types of diagnoses. And it's shown to be pretty effective. In terms of working with children who have anxiety disorders, I sort of like to use the cognitive behavioral based therapies and modalities, but I also use like family systems and, not internal family systems. I know that's a popular one, but actual family systems and family structural therapy to help with some of that and behavior management, because parents sort of don't understand exactly how to respond to their children's behaviors. I've also been using a lot more sort of the brain-based modalities that have come just over the last 10 or 15 years. For example, like thinking about children on the spectrum, utilizing concepts like low demand parenting or using declarative language to help, with some of the rigidity or some of the like demand avoidance that parents find with children on the spectrum. And a lot of the times with children and adults who have ADHD, I use a lot of behavioral modification, including like positive reinforcement, but also utilizing executive functioning skills and just educating a lot of my clients about, the brain and how their brain is working. You'd be surprised at how many people come into my office knowing that they have these behaviors or this diagnosis that was given to them, but not really truly understanding how their brain is functioning in it. So I do a lot of psychoeducation as well.
Mm. Psychoeducation, that seems pretty new to me. Could you unpack that a little bit?
Sure. Well, psychoeducation is sort of educating the client on something that they're experiencing in order to help them understand what is going on. It's sort of like the concept of you can't overcome something without defining it or understanding it. And so if, for example, a child is behaving, let's say they have ADHD and they have impulse control issues, they come in sometimes thinking they're bad because their behaviors are difficult to manage and control. And either they've been through a school system that's giving them negative consequences, or if they've gotten negative feedback from other people in their environment, they think they're bad. But when I give them that education of like, no, this is just sort of how your brain is structured, you just have trouble sort of managing your impulses because your brain is sort of working differently in this way. They sort of the sense of relief sort of comes over them. So empowering people with knowledge and knowledge about their diagnoses and how their brain is functioning under those diagnoses can actually be therapeutic in itself, and why it's called psychoeducation. So it's education with a psychological purpose.
Mm-hmm. So I always ask therapists this, like what have you learned in doing this kind of work?
What I have learned, I think, the biggest thing, I think, especially working with children and families, is we need to sort of start shifting the way that we look at things, especially for children. Um, a lot of children have these negative concepts about themselves, when they're given a diagnosis, because the way that our society is structured, we sort of leave them thinking that this is not normal or there's something wrong with them. And so I think if we continue to go more towards acceptance and inclusion, I think that those negative connotations will start to diminish. I think we're doing a lot of work in allowing for inclusivity around neurodiversity, but I think there's so much more that we can do and talking more about it in a positive way rather than in a negative way. Currently in our society, in our political climate, there's been a lot of negative talk about what it means to be autistic and looking at it as something to be solved. But it's actually something that we should embrace as a society and start to create environments that welcome and accommodate for that rather than try to make changes to it.
Hmm. And what's one thing that is on your bucket list that you're curious about and that you're like, I'm curious about this, or I want to investigate this further.
Well, actually, something I've been sort of thinking about in my mind is learning more about neuropsychology. Because as a therapist who works in the area of depression, anxiety disorders and other, mental health disorders, it really is a huge part of how the brain works. And I think that although I have a master's degree, I think maybe, moving forward and educating myself more on the concept of neuropsychology will just all the more add to my practice and add to giving more of that understanding to my clients because the brain is such a big, like it's I want to say it's sort of the biggest thing that drives our behaviors and emotions, and yet we have such little understanding of it as an organ because all we see is people's behaviors. So I'm a little more curious about that and have thought maybe in the future, maybe pursuing like a PsyD in neuropsychology and just kind of, extending my education towards that.
Hmm. Lastly, given sort of your so how you got into the psychology realm and kind of your journey, what advice would you give to those who are entering the mental health field that want to learn more about, the mental health field and like kind of just dive into the different subjects, that kind of thing?
Yeah, I think what I will say is find, go do the schooling, right? Do all of the schooling. That's great. That gives you a base. And then when you get out, expect all of that schooling to be thrown out the window because where your education really is when you start to find the things that you're passionate about and that you're really interested in and using that sort of self-directed education and those continuing education units that all therapists have to do every 2 years to try to hone your skills and hone your areas of specialty and interest. Not all areas of therapy are people going to be interested in. You just have to find the thing that you're passionate about, and the thing that drives you. Because if you don't, then this is going to be a lot more harder work to do. Than if you did find something that you truly are very passionate about and are interested in and want to sort of consume more as you do this work.
Hmm. All right.